I'm going to kick the expert panel off today. So 3, 2, 1. Good evening, everyone, and welcome to the Thriving Dentist Expert Panel on Digital Dentistry in 2025, Beyond Scanners and 3D Printing. I'm Adisha, your host for this session. At the Thriving Dentist, we're here to help dentists, practice owners, and their teams run thriving businesses. And over the next hour, we'll be sharing actionable strategies for positioning your practice for truly future-ready business. So thank you all for joining us. Let's give a warm welcome to our panelists, Dr. Thaddeus Connelly, Dwight Brown, and Dr. Kathryn Alderman. This is a live event, so please use that chat to ask questions and share your reactions. With that being said, before we dive in, I want to thank our team at Equa Marketing for sponsoring this event. Equa are passionate about this topic because it gets to the heart of what they do every day, helping great practices stand out and succeed. So here's a quick tip from the team. When a potential patient needs advanced care, does your practice show up online as the clear high-tech choice? A powerful digital presence that showcases your technology isn't just a nice to have. It is the single most important asset for attracting high-value cases. And Equa are experts in building just that. Later in the webinar, I'm going to give you a tool to help you strengthen that online presence, so be sure to stay with us. Now, let's get to know our experts. First, let's welcome Dr. Thaddeus Connelly. Dr. Connelly is an oral and maxillofacial surgeon and a full-time professor at UCSF. He brings a deep research-backed perspective to our discussion, focusing on how these technologies will fundamentally change clinical diagnostics and patient outcomes. Dr. Connelly, thank you for being here with us.
Thank you very much.
Superb. Next, we have Dwight Brown. Dwight is the CEO of Dentiza, an AI-driven dental marketing and patient relationship agency. He specializes in translating a practice's in-office technology into a powerful marketing message that drives explosive growth. Dwight, pleasure to have you here.
Likewise, nice to meet you.
Superb. And rounding out our panel is Dr. Kathryn Alderman. Dr. Alderman is a dentist and an MBA and an AI strategist with education from MIT and Johns Hopkins. With her unique background, she connects the dots between cutting-edge tech, workflow optimization, and the real-world business strategies that make it profitable. Dr. Alderman, thank you very much for being here with us this evening.
Thank you.
Fantastic. Now, as we go through our discussion, you will see that it's structured to take you on a journey from the next wave of clinical technology to the workflow and financial strategies that make it work. And finally, to that marketing that communicates your value to a tech-savvy world. Right. With that being said, I'm going to stop sharing my screen real quickly. And of course, it's not fair that we only introduce the host and the panelists, so we would love to get to know our audience as well. So if you guys can do me a big favor and find the chat box down below and just let us know where you're tuning in from so that we know who our audience members are. We'll just take 30 seconds to see the waterfall of responses, hopefully. We got Eliana from Miami Beach. Let's go. Welcome, Eliana. We got Tarun from Ottawa, Ontario. Fantastic. Glad to have you here. Right. So yeah, do use the chat box during the panel to ask your questions, concerns, if you want further clarifications on the answers. or something very specific to your own scenario so that our experts can get to them. I will make sure, well, I'll try my best to make sure that we answer each and every question that you all drop. And with that being said, thank you very much for tuning in, and let's dive in. So my first question is for you, Dr. Connelly. All right.
Yes.
Dr. Connelly, everyone knows about scanners and 3D printers, but this panel is about what's beyond that. What are the true game-changing technologies you see on the horizon for 2026?
So I think it's the hardware is one thing, but it's software and the AI capabilities that are another. I think that's still an evolving situation. I just saw a piece online yesterday or the day before where one of the first things that everybody thought AI was going to do as far as medicine and dentistry goes was to conquer radiology. And it's actually not the case. If you look at the different LLMs, ChatGPT, Claude, whatever, they compared it to on a radiology test and compared it to radiologists and radiology trainees. The AI did much worse than either one of those two groups, and so thinking now that AI is at the point where it's perfect, it's not. But I think it's going to get better and better to the point where it is reliable. But us as dentists and oral surgeons, we still have to be very aware that AI is not perfect, but it will be, I think. And so just time will tell.
Okay. So is that lack of data, like, is that the reason why, radiology hasn't been looking so great with AI?
It's probably underlying architecture of the AI itself. They're trying to do it with LLMs, which have, the well-known limitations. I think as they develop the AI architecture so that it's more self-correcting, that it will be more less hallucinogenic and more accurate.
And so then what are you really looking forward to, on the horizon for 2026 with regards to game-changing technology?
So I think is just that is those AI protocols and algorithms that emerge that solve a lot of those LLM problems. And they're out there. The people that have been working on it for a lot longer than we even knew AI what AI really was. And that's what I'm looking for.
Fantastic. And I'm sure Dr. Alderman can expand a little bit more on that in a bit. And for our practice owners, that's a great takeaway. AI is not the end all to everything. Use with caution. But there are some exciting times ahead when things get a bit more better and improve. So Dwight, next question I have is for you. Actually, building on that, you're an expert in AI-driven marketing. How do you envision AI-powered diagnostics changing not just treatment, but how a practice communicates with and attracts patients in the next 3 to 5 years?
Well, as far as how AI is engaging patients and what I call patient flow, one of the things that the any doctor and that's on this panel or that watches this realize that staffing is a major issue with most dentists. 23% of them say it's their number one issue. And one of the things that we try and do at Dentiza is not replace but supplement what you have as staff, and be able to do some of the mundane tasks in the background. Things like, and I shouldn't use the term mundane because patient engagement is really important part of the process. But when someone's coming into your practice through your digital doorway, you're going to want to be able to engage them in a way that gets them to the point where they're going to reach out and call the office, call the practice, or put their hand up and say that they'd like a call back. So what these AI systems can do is run in the background as your front desk is dealing with a patient right in front of them. It's very difficult to deal with patients and then check emails, check social media, respond to those other communications. So we look at it as a supplemental piece. Now, as time goes on, it's going to be pushed more and more to the front. I do not believe that it's there yet, and I've been working in the AI space in dentistry since 2017. So now everyone's seeing it in their in the industry and in their practices, but I still see it as a complementary piece to your existing staff, and that's where it'll be able to help. And we have practices right now that are fully deploying it in that complementary space.
Okay, in that complementary space, so that it frees up a lot more time for that human experience, I suppose.
Yes, exactly. And there's a cost reality to it too. To have some of those initial engagements happen automatically is also beneficial using AI technology as opposed to just having your staff do it. And one of the things you can do is when you implement it properly with your staff, then you have one variable that's not gonna not show up for work, leave to go to another opportunity. So that's one aspect of your business that you can lock in. Once we've trained it based on your practice and implemented it, you know that those initial contacts with patients can be a place that you don't have to constantly turn over staff.
Okay. Because staff turnover is also a bit of an issue. Can you actually give us like how that implementation went and like how smooth can that process go, Dwight?
Yeah, for example, we just did one for one of our existing clients in Toronto. They one of the things that they did not want to do, because with our AI, and we call it AI Aggie, and it's your 24/7 receptionist. And that's the brand that we have out there. When we had the discussions with them, they have a couple of practices, and they wanted to make sure that, again, the volume of calls that come in, especially after hours, as opposed to it going to voicemail, they wanted an engagement, and that was very important for them. During the day, they were okay looking at the metrics on answering the calls, but after hours, weekends, that kind of thing, that was an issue. So one of the things that we did when we had those discussions was set it up so that it can handle that. One of the things they did not want to have happen is we can go as far as booking patients on the calendar. They did not want that, and I actually think it's a good idea. Again, these technologies can take you so far, but the one thing that we stress over the years with all the practices is empathy is still number one. This is still a healthcare reality, not just business driven, and you're going to want to be able to when a patient calls is have a conversation with them, see how whatever pain point they have, whether it's physical or even psychological, especially in the work we do with the implant and cosmetic, there's a lot of factors that go into why people reach out to practices to have them help them with that. So we make sure that when we go through that process of talking with our potential with our clients, that we make sure that technology will fit with their particular practice and ensure that it doesn't there's not that overlap with their existing human employees. So that's a part of the process. The one thing with AI employees, which we found, is every practice is different. We can't just go in with our AI employee, drop it in, and there's just far too many variables. But once you get it set and calibrated, it's a very stable platform, and it's come a long way. It's come a long way in the last couple of years.
Okay, fantastic. I really like how you framed it as an AI employee. That's a cool new term and way of looking at it. So for our dental practice owners, that can be a real option, when you need someone to work over the weekends, just to supplement things, as Dwight said, so that the human counterpart can do what they do best, and that is to be
Exactly.
there and provide that care. Dr. Alderman, you're a thought leader in this space, the AI space. So let's talk about hype versus reality. Uh, are there areas where the buzz around digital dentistry doesn't quite match the clinical or business reality just yet? And how should practice owners filter through all this noise regarding AI?
I want to be positive, and I want to start on a positive note, so saying that AI is fabulous and AI can help to support us. And AI is my favorite thing ever since I started practicing dentistry. I am absolutely in love with AI. But there is a lot of hype with the AI. And the biggest hype we have is that AI can come in and replace jobs. We're just not there. We just don't have AI developed at that level yet. But what's the biggest problem, and it goes towards the digital dentistry and AI implementation, is how solo our products as of now. It's X-rays, it's scanners, lasers. We have all these products working in solos. We don't have all the systems connected. So now we bring in AI agents that are also disconnected and made by different companies. And they offer some solutions, but it's really too disconnected to help us in the office. It's truly too disconnected. So the challenge is really in the future is to connect all these tools together. Till we have them connected, we cannot benefit from AI at the level that we can benefit at. So the hype is that AI is great, and it's a great hype, but it's truly not at the point where AI can come in and help us, because everything is disconnected in our existing offices. And now we bring in AI agents that are also, most of them come in solos. So because of that, we still have some work to do. We have systems and networks to develop when we can help to connect all the systems that we have in the office and the new AI systems that we have. And that's really will be coming in the next 5 years, and that's will be exciting. So the moment where we really have an AI as our hybrid team, we have AI agents as a hybrid team is coming, but it's we're not quite there yet.
Okay, how far have we come, like in your
Very
experience?
far, very far.
Okay.
And I'm so glad you asked it, because again, I started on a positive note, and I definitely say that there is a certain tools that you can use today and add today that will simplify your digital workflow, simplify your digital dentistry, and actually connect digital dentistry with AI agents as well. And if you want, I can share some companies, but there is definitely some companies that leading the way and doing a great job making just making it really easy for dental offices to implement AI technology while still prioritizing digital X-rays and scanning technology and CBCT if they're using it, and the lab workflow and all other things. So there is a companies that are doing a really great job of understanding the problem that how everything is disconnected. So I guess the answer, if I can say one answer, that really we have to look for not adding more, but how can it kind of connect, how can it be all connected to help us? Because really the less is better. The less is better. If we bring more AI agent, more digital tools, it's actually not easy to manage it all in a dental office. So how can we connect it all? That's really will be the next few years, connecting all these tools. And that's where we will say, wow, that's easy. That's really making a difference for us.
Yes, and I think I speak for everyone. Like AI is totally the new thing that we are all kind of in love with. But as you mentioned, it needs some more development that needs to occur for it to get to that efficient level where everything is a lot more connected. And I would like to take this moment to actually ask our audience, do a little pulse check. What is one piece of dental tech you've heard about, but you're still a bit skeptical of? Would really love to hear what is on everyone's mind in the chat box. We'll just take 30 seconds for this. Just to get to know what's the biggest question mark in your head with regards to the tech. Okay, as our audience members are typing those answers in, I'm going to move to Dr. Connelly. Dr. Connelly, from a clinical standpoint, what does a truly seamless, fully integrated digital workflow look like in the dental practice of the future? If you could paint a vivid picture for us, that'll be great.
Sure. So I've actually thought pretty deeply about this. I think in the future, what would be ideal is to have a kind of have AI not so much replace what dentists do or replace what dental hygienists are good at, because that'll always with dentistry you always need somebody kicking the tires. Somebody's got to have hands on the patient. So AI is not going to change that, but I think it could change systematically how dental offices, both large and small, operate. So have thought about where you have an AI first dental operation, where the patient starts with imaging. Patient has X radiographs, clinical imaging. AI takes that and chews on that and comes up with a diagnosis and a treatment plan in the back end. And then the first person, let's say this is a patient new to a practice, the first person that patient sees is the dental hygienist, because the dental hygienist is the one, they're going to see the dental hygienist pretty much regardless of what's level of severity they are. If they have no dental disease, they see the dental hygienist and that's it. They have a lot of dental disease, they're going to see the dental hygienist and move on. And so but the whole point is that the practice is using that AI first to bring that patient in, create a risk, stratify that patient, and then there's going to be a human in the loop at that point. Both the hygienist and a dentist is going to look at the data and decide, okay, this patient goes to hygienist, comes back 6 months. That's just one day out of their lives. But say they have like 5 cavities and they need a crown or something like that. So now they need to go to the dentist. And so what the dentist does now, instead of filling his schedule with exams and cleaning and things that don't pay him money, what he does now is he can fill up his schedule with patients that need procedures. And again, this is all driven from the AI first. And so that level at that point, you could even have a group practice where you can then go get the general dentistry, and then say they're 17 years old and they need wisdom teeth, and the AI first can make all of that much more streamlined. And in the end, what will happen is that the provider's satisfaction will increase because they're making more money, they're being more efficient, and the patient's satisfaction will increase because they have less time they have to spend. Maybe their dental insurance decreases, and I think using AI in that manner, can be really it can be really part of what AI can do for us in general.
Right. That sounded like a very holistic practice. And I mean, one without a lot of that overhead stress with regards to the admin tasks that, so prevalent. Just there is actually a follow-up over here, Dr. Connelly, by our audience member, Alyssa. So she says, I actually did a LinkedIn post about this today. A big point of contention is actually not the AI tech itself. It's a true adoption of the practice team members. Do the team members believe in it? Do they present it for optimal case acceptance? The AI tech presents large gaps in the practice. What are your thoughts on this, Dr. Connelly?
So that's the thing. I mean, you see the trend of dentistry across the country is for dental practices to sell their shop and join a DSO. And the reasons they do that is to make things more efficient, so they don't have the staffing problems. They don't have all of the back end problems that dentists usually don't go to school for. And so that's one thing that AI can pick up if they want. If they want to stay independent, it can pick up all of those functions that they join a DSO for. So if they can stay independent if want, and then it can make DSOs much more effective. So it's all stepwise. But the thing is that you have to envision it before you build it. And so it's going it's going to, like Dr. Alderman said, it's going to take time. But if you don't think about it and plan for it and then build it, you're not going to get it. But I think you could really, dentistry could really serve a lot more people than it currently does. So I think we all as dentists admit that we're sort of failing the population because there's only a certain percentage that can get dentistry, and there's a lot of job satisfaction issues in dentistry. And so I think we use AI as an opportunity to make that all better.
Right. Absolutely. Even in the previous week, one of our panelists mentioned that there is a lot of burnout that is occurring within the industry itself just because of the overwhelming amount of work that is there. So it's amazing that the ideal way to move forward with AI is to really keep that independency while gaining that DSO efficiency along the way. Thank you for that, Dr. Connelly. We also love to keep independent private practices in business, Alyssa. Yeah, so Dwight, you work with practices in 6 different countries, and keeping independent practices alive seems to be a part of what you do. So how is cloud-based collaborations changing the way dentists, labs, and specialists work together on a global and local scale?
So can you elaborate on the labs with the dental practices? What are
Yeah,
you?
so how is cloud, so from your experience working in 6 different countries, how does it look like? So since we're working in a cloud-based collaboration, right? How does that look like? How has that experience been for you? Just so we can have an understanding of like
Right.
what
Well,
working together looks like on a global and local scale.
there's a lot of considerations, especially I'm here in Canada, in Ottawa, and one of the things that the practices have to be very cognizant of when it comes to cloud computing is where is the patient data stored. Each country is different. We're in Canada, the United States, Singapore, the UK, New Zealand, and Australia, and each country has their different rules and regulations. So one thing that we're very cognizant at with Dentiza is that patient data is not stored in our environment. It's stored where the practice is. We have name, phone number, email address, some of that information. Our software is HIPAA in the United States and PIPEDA in Canada compliant, but we really try and separate church from state, so to speak, where the data that is our patient charts are not something that we're managing. And how we term it is we're a dentist's digital doorway. You know, when a dentist opens up a practice, they have their physical doorway, their address, all of that. But before anyone comes into the practice, they're going to reach out in some digital manner, whether it's online, you know, through a contact that they've reached, and then they're searching social media. So we just get the patient from where they are into the digital doorway. Our technology then moves them further to the point where they're going to engage the practice and physically go in the door. So the regulations, like Singapore, for instance, is super restrictive on what you can do and can't do. So we have to be very cognizant of that. So when it comes to our data kind of works in its own silo that the practice can access.
Okay, so there are good, points when there are good points when it comes to silos, especially when it comes to the concerns of patient data. That's a great point, Mr. Dwight, because our dental practice owners that are watching this here, and they have this concern, everything is cloud-based when we're working together on a global scale. There you go. That's the answer. The patient data will be in your practice in that local vicinity.
Yeah.
Dr. Alderman, you specialize in optimizing workflows. What are the real-world barriers, the human or process challenges that stop practices from adapting these digital workflows smoothly? And what's the secret to overcoming them?
Oh, I love that question. What a great question. Number one, humans, and just basically fear of not knowing, not understanding technology, and not having time to implement technology. So my steps are very simple. It's a 90-day implementation, only focusing on one problem. When we want to bring an AI or any technology to the office, first of all, we have to identify what problem are we solving. Can we measure that problem, and how do we measure that problem? And once we define the problem and that we can measure it, when we can show that there is a problem, now we can communicate to our teams, or we can communicate to our doctors, we can communicate to people involved in solving this problem. And that's the best way to implement AI or any type of technology in a practice, by really engaging your team or engaging doctors, hygienists, or dental assistants in showing what the problem is. For example, if you bring in a digital impressions, you want to show how much money you can save, or how much more it's pleasant for the patients to have a digital scanning versus a messy, gooey impressions. If you bring in AI technology to collect from insurances and maybe to complete the insurance verifications, you want to show this AI technology in action and how much time you can save to our team members by not calling an insurance benefits. And it's on and on and on. You always define the problem. Can you measure the problem? Just because you're excited about technology doesn't mean it may solve the problem. And so it's very important to identify the problem and then clearly to show that, hey, this is how we're going to solve it. And then to allow 90 days to implement that technology in your office. Only one technology or one AI at a time, never more than one, until everybody understands it, till everybody gets it, including fast learners and maybe slower learners. Then you can move on to the next technology. And again, you don't have to have everybody on board. There will be some people that may never understand the technology or agree to that, but the majority need to be comfortable with that before new technology or new AI tool is implemented. This is actually called a change management model, and it's a change management model. It's actually a business model, how to implement a change and ensure that change stays in any organization of any size for a long time. Because we can teach people and we can talk about something, but they may try to do that, but for the change to stay, that's important as well. So hopefully it answers your questions, that humans is really execution by humans. That's the biggest barrier. but then how we execute, that's really solves that problem.
Okay, how we execute definitely solves a lot of problems, and as you mentioned, it's it's also a part of change management. So getting down into it and not just looking at it as like a small, I don't know, a high tech, something like that, that you can just, bring one day and then implement it the next day, but really taking that time to give it that respect that it deserves. 90 days, one
Yeah.
problem at a time. Fantastic. Thank you very much for that, Dr. Alderman. And I would actually like to engage with our audience one more time. So it's a poll. So, what is the biggest barrier to investing in new technology in your practice right now? I'm going to run this poll right now. Just launch it for 30 seconds. Let's see how it goes. So, the poll options goes as initial cost, uncertain ROI, or financial risk, team training and adoption, integration with existing systems. Depending on your answers, this panel can go in another direction. So would love to hear what are your biggest barriers to investing in technology in your practice right now. Okay. We'll have it on for a little bit longer because we got some answers coming in. We got a person saying integration with existing systems. And yeah, there we go. Yeah, it seems the majority of our audience believe that integration with existing systems seems to be one of their biggest challenges when it comes to implementing this new technology. Actually, Dr. Kathryn, I would like for you to expand on it because it continues off your previous answer. What do you think of that?
Well, I think that's interesting because on a medical care, that's not as existent. All systems are connected. For example, if you're doing an oral surgery and a full mouth rehabilitation, or maybe we're doing a complex case, it's very important to have a digital workflow to accommodate that case. And the digital workflow starts from a pre-op of looking at the patient and taking records to showing a patient what it looks like to working with the lab and then delivering a case as well. So really, when we're talking about digital tools or a digital workflow, and then we add in AI on top of it, AI can be really helpful. But truly, it really comes down to how many workflows can we have in an office that are connected. It's really, I would say it's really the goal. It's like hey, if you have a team, you want the team to be connected and how it's working. And when we have all these tools now, and then we add in AI tools, there is not enough connection between all the systems and a PMSs as well. So really, and it's the problems that we're solving. For example, I want to talk about Soda Cloud that is solving that problem. And then there are companies like mine that we're solving a problem of all the AI agents talking to each other and being connected. So basically, do you know what we need in dentistry? What we need in dentistry, we need all these AI companies and the technology companies to come and say, hey, we all want to work together because really we want the doctors to have an easy workflows and we want patients to have a great care. But right now the biggest problem is that many systems are closed. They don't want to be open to another company. They want to have their own ecosystem, and you have to come into the ecosystem to work with them. So now we have all these ecosystems and all these platforms that not wanting to work together. And again, it will take us some time to get there, but I do believe AI will force us to get there. AI will force us because at some point, AI is a powerful change because AI is a powerful change and all of us will have to adjust to that. And technology companies, AI companies will have to adjust to it as well. So I think at some point, again, in the next 5 to 10 years, you will see that that will be goal of many technology companies, of many AI companies, to help dentists and dental offices to have everything interconnected. We're just not there yet. We understand it's a problem.
Right.
We don't have enough solutions yet.
Right. And just piggybacking off of that, the idea of adopting technology strategically seems to be the key here to all of this. And I'm sure the question on everyone's mind is, how do I build a marketing strategy that justifies all these investments and attracts the right patients to maximize my ROI? Well, that is the perfect opportunity for me to share that gift I mentioned from our team at Equa Marketing. So, right. So, as a thank you for being here, Equa Marketing are offering every attendee a complimentary marketing strategy meeting. This is a true strategic session valued at $900, where the team at Equa will evaluate your online presence and deliver a customized plan to connect with you more of that high value patients who need and appreciate this advanced technology. This is the logical next step to ensuring your investment pays off. The link is being dropped in the chat now. I highly recommend you to open a new tab and book a time. It'll only take 60 seconds. With that being said, let's move on. Oh, yep. So, Dwight, let's pivot to that very topic. Do you see digital adoption as a major differentiator for growth, or has it simply become the new baseline expectation for any competitive practice?
I think it definitely is going to be the baseline for any practice that wants to go forward. If you look at the demographics as the Gen Xers of my vintage start to age out of the marketplace, you look at millennials and Gen Z, their first preferred way of engaging is not to necessarily pick up the phone and call the practice. They might look on social media, they might look on whether it's an email or some other form of communication that's digital. And you're going to have to be able to be more than a static two-dimensional website. You're going to have to be able to, while your treatment coordinator or your front desk receptionist is dealing with someone face to face, you got to have a platform that can engage these patients. And that's where some of these LMMs that we can integrate into your social media can engage that person so that they do reach out and decide to book a call or come into the office and for a consultation. So just you have to have platforms and touch points out there digitally that allow for potential patients to reach out and to engage. It can't be just a static one way where they're just reading data off of information off of a website, and then they'll engage and book a call.
Absolutely. With the growing audience of millennials, patients of millennials and the Gen Zers, it's even more imperative that we start thinking. Yes.
Because I really want to take this because this is really my favorite topic to talk about it. I specialize in AI agents and I specialize in growing AI agents and training AI agents. And I want to say this very loudly so everybody knows, because that's really AI has changed. And it's maybe not where we just can do everything with the AI in the office. But one thing is very clear, and it's happening today, it's happened yesterday. Everything in marketing has changed, and Dwight is right. Everything has changed. So the biggest change that all of us need to be aware, and every single dentist, that really people don't go to Google. They don't go to Google anymore. And the Google ads and the way the Google is, and they still will go to Google overviews. They will go to Google overviews, but they don't go to what traditionally how they used to find people. So they actually go to Instagram, they go to Facebook, they go to Twitter, they go to ChatGPT, they go to Cloudy. But what I want to say, what is the biggest change, and again, I love AI, but the biggest change that AI is so fast that with the traditional ways, you could have done search engine optimizations that would have taken 3 to 6 to 8 months. Guess how
Yeah.
fast you can be showing up now? Guess, just guess. That can be shown up in 1 week. So because of AI is so fast. So I think when we talk about digital dentistry, when we talk about it, how to actually cater to savvy patients, to patients that like technology, we have to be listed on AI search so those patients
Yeah.
find us. That's number one. So when dentists do use technology, they do want those type of patients to know about technology and AI tools that they use. Was dentists to really need to start showing up on an AI search, because and really that's what I do a lot with the AI agents that I work with. But I think it's very important that's very important for dentists to know that has to change. And Dwight is right. I will talk to Dwight, but AI search is here and it is replacing all traditional marketing.
Yeah,
Yeah,
absolutely. At
and if I
the
could add, you need to know what the web crawlers that operate for the AI chat GPTs and Claudes, what they look at. And it's
Got it.
not, and some of it is SEO based kind of stuff. A lot of it's not. A lot of it's just kind of how your website points to web crawlers. And so it's really a very in-depth detailed thing that you have to have somebody who knows about that to be the next person to run your marketing.
Absolutely. At Equa is, we actually had a whole overview, and our COO actually published around 5 emails to every one of our clients, just updating everyone on this particular change because people can be confused. They're not getting website views. We got 0 clicks thanks to AI overviews, but how to really rank on there, as Dr. Connelly said, perhaps even looking at the CRUX. Now with Gemini, for example, they're really doubling down on how the Chromium experience looks at website. So
You got to know
really,
how to write the schema for your website. So that there are specific things that I'm not a programmer or engineer, but I read a lot
exactly,
about trying to figure out how to make it better. And
exactly.
that there are like for instance the web crawlers like Bing more than anything. It's like in Wikipedia, and so
Exactly.
it's kind of crazy. But the other thing is not going to change. I mean, it is going to change. What the web crawlers look at now is going to be different 6 months from now. And so you're going to have to be able to be dynamic in how you present your information.
Yeah, absolutely. And even we truly double down on this at Equa because we have around 9 teams just full of webmasters looking at exactly just that, and 14 other teams who are doing client servicing. So I mean, it's very exciting times. It really double downs on the independency and generates a lot more efficiency with regards to that. But at the same time, you got to really know what these AI searches are looking for. And I think we're going to pivot a little bit. Dwight, from a marketing perspective, do you believe these digital tools can directly strengthen patient trust and case acceptance? If so,
100%.
we would love to hear an example of how.
100%. I'll give you, one of the things that our company really focuses on is video on top of the technology that's there. One of the things that is very important, especially in the digital space, is for the potential patient to get a sense of what the practice is, who the dentist is, a little introduction to the practice, so that they have a comfort level. And we integrate that into not only our outreach to potential patients, but once they've requested a free guide or have interacted, a quick SMS message while thanking them with a short little video blurb from the practice helps with that sense of connecting with the potential patient. And one of the things is I always stress is the empathy component has to be real from the practice to the potential patient. And the way we gather data from the patient, that gives the practice the ability, the treatment coordinator, the ability to connect with them by relaying the pain points that the potential patient has, and it allows them to better connect. But video is a very, very strong component of it. It's one that a lot of practices are doing, but a lot of practices could do it a lot better with something as simple as, hey, you request a free guide, send a quick thank you via SMS, and with a little video thanking them. That's just one very powerful example of what practices can do now.
Fantastic. I mean, video is the best and the most engaging form of content out there. So it's a given that you should be incorporating that into your marketing strategy. Dr. Connelly, how can practices best communicate their clinical value of their digital technology in a way that truly resonates and educates today's tech-savvy patients?
Well, you see, I think this is where dentistry can and should go towards, is connecting what goes on in their mouth to the rest of their body, to their systemic health. And as dentists, we kind of get siloed into that. Oh, this is just in your mouth. How does it affect any other part of your body? Well, a lot of the problems that happen in your body can start in your mouth and your gut. And I think as dentists, we have an opportunity to use the digital technologies to go forward and connect what happens in our mouth to the systemic, the rest of your body. For instance, even if it's just people with gum disease, 50% of the population has at least some gum disease. And so if you have a little bit of gum disease, those bacteria, bad bacteria, are going to make it to your gut and cause dysbiosis or bad altered bacteria in your gut. And so both of those things together, your mouth and your gut, can be inflamed, can cause chronic inflammation. And those inflammatory mediators go to the rest of your body. They circulate in your bloodstream. And that chronic inflammation is what drives all the diseases that kill us. So heart disease, diabetes, stroke. And so it's an opportunity, I think, for dentists to take the digital dentistry part, the AI-driven knowledge part, because that's what AI is really good at. Or at least the LLMs is going, you know what, you have this type of bacteria in your mouth. This type of bacteria has been tied to these 5 different systemic diseases. And this is how I, as a dentist, can help you control that. And so I really think this is an opportunity for dentistry to take hold of what AI is offering and use that to to really change how dentistry looks.
That's very interesting. I mean, from what I understood are you talking about a cloud-based hospital? Like there's dentistry, there's other aspects involved as well?
Well, yeah, I'm just talking. I'm basically talking about how you connect a patient's oral health to their systemic health, because the mouth doesn't have a different blood supply. The mouth doesn't see red blood cells differently than your brain does. It all circulates. It's all connected. And as dentists, we have an opportunity to take that information, that which AI is improving every day, and bring that to the patient and going, look, this is why I'm concerned about your gum disease, not just about your gum health or that you're going to lose teeth, but because it could contribute directly to your heart disease or your high blood pressure. And so AI can help that, because it can look at a patient, take their background medical history, and put it all together, whether you're a dentist or an eye doctor, can help create a digital twin and bring that patient's health history in front of them and in front of the dentist. And and I think that could be really powerful.
that can definitely be very powerful, Dr. Conley. I mean, that's an ideal system, as we talked about earlier on. I'm assuming that interconnectedness of all these medicinal fields that are otherwise working in silos. With that, actually, Dr. Alderman, looking ahead, what role do you see emerging tech like AI or even augmented reality play in patient engagement and education in the coming years?
I would love to echo what Dr. Conley said. That's really to show patients the disease and really to show that visually. And once patients see what the disease looks like and the consequences of a disease, they will actually believe and accept the care. Because in dentistry, most patients don't trust that they have a disease because they simply cannot see it, or they don't have symptoms. So if we have VR or AI technology such as Overjet, Pearl, Valmany, that can show patients visually that disease, that's great, but we can go further. For example, Valmany is a great one. Valmany can actually have a VR where when a patient can see what it looks like and they can see the dental conditions in a VR. It's really about letting patients see it and getting them more engaged in their care, because visuals and videos go so far in helping patients to understand the disease and importance of fixing it. And the technology and AI tools can allow us to do that. I really see this. I know I don't see it. I'm confident it will be there. That me and Dr. Conley are really busy and we doing hygiene checks, and my AI avatar is explaining to a patient what a root canal and showing what happens when root canal is not done. And remember, the patient is captive in that moment. The patient is on a chair. The patient really has two choices between being on his or her cell phone or looking up at that video. So the patient is going to look at that AI avatar describing needed dental treatment. And when me or Dr. Conley come in the room, the patient already heard that. So we will be now a second opinion or even a third opinion if AI showed their own x-rays. Does it so really using technology from a point of engagement and helping patients to understand their problems and seeing it visually, it's amazing. And we are getting to the point where AI can speak well, it can speak fast, and we're just about a year away where AI can show and explain x-rays and talk more about disease and even have videos that can be that AI can use to explain the treatment. So this is not just the future, this is here, it's being all developed, and it's definitely will help patients to be more engaged. And I'm excited because ultimately it will help patients to be healthier, live longer, and really ultimately we're going to have an AI supporting us. We're going to all have a better medical care, dental care. The life is looking really good with AI.
Yeah, and that's the point with a digital twin, is that you can exactly say, this is your digital twin with bad gum disease. This is what your digital twin without gum disease, for instance. And you can show that specific individual their specific changes over time if a disease is treated or not. And that's going to be the power of AI in the future.
Yes.
Wow. Wow. I mean, that's really powerful stuff. And knowing that it's not far away into the future, but just 1 year ahead or 2 years of getting there, both for digital twin and then even Dr. Alderman's avatar version, perhaps. So really fun stuff. And with that being said, we are approaching end time. Dear panelists, it has been an incredible look into the future. Before we could go, can each of you share a 30-second final takeaway for our audience? Let's start with Dr. Alderman.
I just always say, if anybody watched 90 Day Fiancé, do the same for AI or technology implementation. I always say it's like a 90 Day Fiancé. You want to use 90 days for any type of technology or AI implementation, and do one problem at a time. Don't go to a conference, get excited, and want to implement more than one solution. That's it.
Okay. Mr. Dwight?
Yeah, to Dr. Alderman's point is you can't do multiple things at a time. One of the things we see is if you have the dentist owner who's on board and the treatment coordinator is on board, you start there. And the treatment coordinator is usually the strong force and champion in the office. So you start there, you work with them, and you make sure that the AI technology that you're implementing is complementary to what's going on and not trying to override everything that's going on in the office. You'll get resistance if you come in very hard with the AI. But you do need a champion, not just at the dentist owner level, but also at the staff level, whether it be the office manager or the treatment coordinator.
Right. And Dr. Connelly?
So I see the linchpin, the crux of making all of this work is to give the medical record, the electronic health record to the patients, so that the patient the information walks around with the patient. The patient walks into an office with their medical health record, shakes hands with the local electronic record of the dentist. Patient walks out. They control the lock and the key, and I believe that has to happen for real, true AI adoption in care.
Wow. I mean, that was really fantastic takeaways from all around the board. Really appreciate everyone being here. And as we wrap up, I want to remind everyone about the incredible opportunity from Equa Marketing. If you want to turn tonight's discussion into a concrete action plan, book that free marketing strategy session. It's probably the single next best step you can take. Link is in the chat one last time. And finally, your feedback is essential for us. An automatic tab to a very short post-event survey will open up as you exit the event. Please take 30 seconds to fill it out. It's how we ensure we are bringing you the most valuable content possible in the future. Dr. Connelly, Dwight Brown, and Dr. Alderman, thank you once again for your time and your incredible wisdom. And to our audience, thank you so much for investing an hour with us tonight. My name is Adisha. Have a wonderful and successful rest of your week.